Roughly 1 out of every 3 men watching this will experience premature ejaculation at some point in their lives. Millions of guys deal with it, yet almost no one brings it up in casual conversation, or even with their doctors. Clinically speaking, premature ejaculation, or PE, is defined by 2 specific factors. It happens when a man ejaculates within 1 to 2 minutes of penetration, and it occurs with almost zero physical control over the timing. Because nobody talks about it, men are left in a vacuum to process what's happening. They usually internalize that lack of control as a personal failure, a character flaw, or an embarrassing hit to their masculinity. PE is a documented medical condition where the biological timing system operates out of sync. It is a complex physiological response, not a failure of will or a sign of weak character. Staying silent and treating the issue as a taboo only guarantees that you keep suffering through it. Once you look at premature ejaculation as a biological system that's out of sync, you can actually take the steps to recalibrate it. Look at this graphic representing the central nervous system. Every man has an ejaculatory reflex threshold, a physical point of no return built into your internal wiring. As arousal builds, the gauge rises until it hits that hard limit. But in some men, biological factors essentially hack this system. Hypersensitive nerve endings or prostate inflammation can bombard the brain with an accelerated rush of signals, causing that needle to spike wildly out of nowhere. Then there is the chemical side of the equation. Ejaculatory control relies heavily on serotonin, a neurotransmitter that helps delay the reflex. If you have naturally low serotonin levels, your body loses the chemical friction it needs to slow down the process, letting the nervous system slam right past the threshold. And for some guys, the baseline for this threshold is actually written into their DNA. If you've dealt with this since your very first sexual experience, you likely inherited this rapid reflex setting, a condition diagnosed as lifelong or primary PE. Whether the hardware is overly sensitive or the neurochemistry is unbalanced, sheer willpower is useless against a hardwired biological reflex. You can't just think your way out of a physiological response. But the mind does play a crucial role. Performance anxiety is a heavy physical catalyst. Worrying about pleasing a partner actually overstimulates the central nervous system, accelerating your body toward that exact same threshold. General life stress, a habit of overthinking, or unresolved feelings from past experiences add a massive mental load. That psychological weight acts like an accelerant on the ejaculatory trigger. There is also a cruel overlap with other issues. If a man starts experiencing erectile dysfunction, he will often mentally rush the entire process, trying to reach climax before he loses his erection. Over time, that panicked rushing inadvertently trains the brain to link sexual activity with a sense of extreme urgency. The nervous system learns this new rhythm, establishing a conditioned pattern that turns early ejaculation into a permanent habit. Unresolved anxiety and secondary sexual dysfunctions actively rewrite the brain's default timing mechanisms. Over time, these pressures cement a habit that requires deliberate, structured intervention to reverse. One highly effective non-medical intervention is the stop-start method, also known as the Siemens technique. It involves purposefully pausing stimulation just before you reach the point of no return, letting the arousal fade, and repeating the cycle. This manually trains your brain to recognize and delay the threshold. A similar approach was pioneered by the famous researchers Masters and Johnson. Their squeeze technique involves firmly squeezing the tip of the penis right at the moment of near ejaculation. This physically forces a reduction in arousal, manually interrupting the reflex cycle. This mechanical diagram shows the pelvic floor. By performing regular Kegel exercises to strengthen the bulbocavernosus and pubococcygeus muscles, you build an internal tightenable clamp. This gives you active physical muscular control over the entire ejaculatory system. None of these are overnight fixes. Rewiring a severed mind-body connection takes weeks of consistent, deliberate physical therapy to see significant improvement. For men who need a chemical reset, doctors often prescribe specific SSRIs, like duloxetine. By artificially boosting the amount of serotonin active in the brain, these medications biologically delay the ejaculatory reflex and increase your baseline threshold. If the problem is localized, topical anesthetics like lidocaine sprays or creams are used to temporarily dull hypersensitive nerve endings at the glands, preventing them from sending those rapid-fire signals to the brain. And if the early ejaculation is a secondary symptom caused by rushing due to erectile dysfunction, doctors will treat the root cause. Medications like sildenafil, shown here in the classic packaging, stabilize the erection and eliminate that psychological need to rush. The strict medical timeline is simple. If this issue persists for more than 6 months, causes severe relationship distress, or appears suddenly out of nowhere, you need to consult a urologist. Science has provided a clear map of how the ejaculatory reflex works. Through a combination of behavioral training and medical support, men can move past the stigma and begin to reclaim their sexual control.